Hello, this is the daily COVID update from Deccan Herald. I am Akhil. On the bulletin today, lockdown 5.0 is likely to be announced this Sunday. Karnataka reports 135 new cases, and later in the bulletin we speak to Dr Veena Shatrugna to find out if the exodus of the migrant workers will lead to another crisis, this time one of malnutrition.
I suspect that we'll have a whole epidemic of kwashiorkor and marasmus. Now, if I may explain, kwashiorkor and marasmus were these classical children with bloated tummies, skin changes, and totally lethargic kids. India had almost got rid of this kind of malnutrition. I think we can expect an epidemic of that.
But first, a look at the daily figures. At the time of this recording, India has over 84,000 active cases in the country and has recorded over 4,000 deaths. The ICMR assessed more than 32 lakh samples with novel coronavirus so far, and more than 1 lakh samples in the last 24 hours. 1 million tests were conducted from January this year to 3rd of May. However, the next 2 million tests have been done in just over 20 days. Moving on to some national updates. Prime Minister Narendra Modi is likely to announce the details of Lockdown 5.0 in his monthly radio address this Sunday. The 2-week lockdown is expected to be limited to a few regions, and states are likely to assume more power with the implementation. The focus remains on 11 cities, including Bengaluru, that account for 70% of COVID-19 cases in the country. Shopping malls, cinema halls are expected to stay closed, but religious places will be opened with physical distancing norms. The Supreme Court has asked the Centre and the Press Council of India to respond to a plea questioning fake news run by some TV channels after the Nizamuddin Markaz incident. A press bench presided by Chief Justice S.A. Bobde has asked for a response within 2 weeks regarding the actions taken by the Centre and the Press Council on the alleged violation of the Cable Television Regulation Act by the news channels. A PIL filed by some Muslim scholars has questioned the use of terms like Corona Jihad, Corona terrorism, Corona bombs, and Islamic insurrection to demonize the entire Muslim population. Additionally, the Supreme Court has also asked the Centre to respond to a plea for a CBI probe into the assembly of people at the Nizamuddin Markaz after lockdown was imposed due to COVID-19 pandemic. Moving on to the numbers from Karnataka, 135 new cases were reported from the state today, as of which 123 cases have an interstate travel history. Bengaluru Urban is the only district to report a case from the UAE. The other cases are contacts of previously diagnosed patients. Kalaburgi has reported the highest number of cases today. All of the 28 new cases are from those who have returned from Maharashtra. 16 new cases are from Yadgiri, 14 out of 15 from Hassan, 12 out of 13 in Bidar, and 10 out of the 11 new cases in Dakshina Kannada have traveled history to Maharashtra. Udupi, Uttara Kannada, and Raichur have all had cases who have returned from Maharashtra as well. 3 deaths due to COVID-19 have been reported today. Patient 2301, a 69-year-old woman from Yadgiri district, had returned from Maharashtra recently. A 49-year-old man who had been diagnosed with Sauri with complaints of fever, cough, and breathlessness and had a history of diabetes died in Bidar today. Meantime, an 82-year-old man who had complained of fever, cough, chest pain, and breathlessness passed away in Vijaypura. With this, the state has reported 2,418 cases so far, of which more than 1,500 are active cases. 781 patients have recovered, 14 are currently in the ICU, while 47 have died. The state has assessed just over 12,500 samples in the last 24 hours. The Karnataka government has instituted new guidelines for international travelers. The new rules call for 7 days of institutional quarantine, followed by 7 days of home quarantine for those who test negative for COVID-19 on their return. These guidelines will apply to the new arrivals and not those who have arrived on repatriation flights earlier. Moving on in a series of conversations looking at the post-COVID world, yesterday we looked at the job and food prospects for lakhs of migrant workers once they reach their homes. While the union government has doubled the ration, we know that millions of families will be left out of the PDS. For those who are covered by it, will the food available cover nutritional needs? My colleague Nitin Krishna spoke to Dr Veena Shatrugna, a nutritional scientist and a retired deputy director of the National Institute of Nutrition.
Thank you, doctor, for joining us. Are the migrant workers actually getting enough food through the public distribution system?
Now, when announcements are made that 5 kilos of rice or per person, okay, or 1 kilo of dal per family has to be given, Nitin, you and I can calculate. 1 kilo of rice per person works out to about 150 to 160 grams, which is 500 calories per day. 500 is actually considered a starvation diet. If you look at the figures of FAO, starvation is when you're consuming less than 500. And dal works out to 1 kilo per family would work out to 1.5 teaspoons of dry dal, that is uncooked dal, which is really a mockery of a population. They're not beggars. They have been working, supporting their family, proud people, sending money home, educating their kids.
How migrant workers, especially pregnant women and children, are affected during the exodus.
I suspect that we'll have a whole epidemic of kwashiorkor and marasmus. Now, if I may explain, kwashiorkor and marasmus were these classical children with bloated tummies, skin changes, and totally lethargic kids. India had almost got rid of this kind of malnutrition. I think we can expect an epidemic of that. Definitely, we will have children who haven't put on weight, who haven't put on height. So you'll have underweight kids, you'll have thin kids, you'll have mothers giving birth to small babies who look like rats rather than a good birth weight. Because if mothers have not eaten well, then the babies don't grow. And a normal weight gain in pregnancy should be around 10 to 12 kilograms. These women may just put on 2 to 3 kilograms or even less. Remember, children require more than half the amount that an adult eats. And I can explain to you, if you like, why. Because children are growing and their per kg requirement is higher. They require about 80 calories per kg. You and I require 25 to 30 calories. So children require 2.5 times food that you and I do.
Also, does India have enough food reserves to feed the migrant workers?
60 million metric tons are lying with the government. Pulse is lying. They have emergency powers they could invoke wherever required, like Bombay is invoking for hospitals. So I have a feeling the government lacked imagination. They lacked advisors. They didn't even believe that India is capable of feeding its poor. This could have and can still become the world's largest experiment in famine, which is not driven by war or pestilence. This is a man-made famine. The earlier famine studies have been in the Second World War. And we have an idea of perfectly normal people who suddenly starve and what happens to their bodies. In India, it can still become a famine where you have undernourished people who are already taking 30%, 40% less food and they starve, because nowhere in our textbooks do we have these pictures. India will have the distinction of contributing this information to the world, and that would be very, very unfortunate.
As a nutrition scientist, what would be your suggestions about remedial measures?
So we must now put in place quick remedial measures, if possible, to first measure, survey, and feed. Now, what is the method of feeding? It's not difficult. Please pull out, every village has self-help groups. They have panchayats. They've got PDS shops. Luckily, we are linked through 2 or 3 networks, and PDS outlets are one of the best. Postal department is one of the best. Panchayats are there, and then you have other NGOs working. Use all the networks, and please don't do it from Delhi. Do it. Let the state governments take over, hand it over to districts, and believe me, our collectors are capable of saving the country even now. Because immunities, these molecules that you can measure, IgG, IgM, etc., which are protein molecules, and if you can give boiled eggs, if you can give lots of pulses, nuts to families so that children are fed, women are fed, of course adult men and old men also. They waited 40 days before they marched back. So it's very unfair to say that they had no business to walk. Yes, these are the scenes that will haunt us for years to come.
That's all from us today. For the latest updates, log on to deccanherald.com. Stay safe, and we'll see you tomorrow.